In this video, I'm going to talk to you about attention deficit hyperactivity disorder. This is primarily the diagnostic criteria for what this disorder is. Now, there's three types. There's the inattentive type, or predominantly inattentive type, the hyperactive type, and the combined type. We're going to go through and list all the criteria and basically what you would need to have in order to have this diagnosis. That being said, this is the DSM-5 TR. This is not something to use to diagnose yourself, but if you go through this and a lot of these are clicking, yeah, that would be a good thing to see a clinician and to see if you have this diagnosis. In upcoming videos, I'm going to talk about the changes that are in the DSM-5 TR compared to the DSM-5. The diagnostic criteria is the same, however. So let's get to it. So first thing, a persistent pattern of inattention and or hyperactivity, impulsivity that interferes with functioning or development is characterized by one or two things. The inattentive part, 6 or more of the following symptoms that have persisted for 6 months to a degree that is inconsistent with developmental level and that negatively impacts directly on social and academic occupational activities. So if it's a little bit, it doesn't meet criteria. If it's often, yes. So first one, often fails to give close attention to details or makes careless mistakes in schoolwork, at work, or during other activities. So this is overlooking details. This is turning in papers without your name on it. Small things. This is reading which one of these, and you just skip over. Oh, which one of these is an example? No, it was actually which one of these is not an example. Things like this, that small details that are overlooked. Often has difficulty sustaining attention in tasks or play activities. So this could be remaining focused during a lecture. This could be remaining focused during a uninteresting YouTube video. Often does not seem to listen when spoken to directly. So you say something and it just doesn't stick, or you say something to someone else and for them, yeah, it's like you didn't say anything at all. Often does not follow through on instructions and fails to finish schoolwork, chores, or duties in the workplace. So starts tasks but are easily distracted. Often has difficulty organizing tasks and activities. Difficulty keeping materials and belongings in order, messy, poor time management, that type of thing. Often avoids, dislikes, or is reluctant to engage in tasks that require sustained mental effort. So schoolwork, homework, reading, reviewing lengthy papers, preparing reports, that type of thing. Often loses things necessary for tasks or activities. So this can be pencils, glasses, phone, wallet, keys. Often is easily distracted by extraneous stimuli. So this can be unrelated thoughts. This can be daydreaming. This could be someone tapping a pencil and you just keep going to that tapping of the pencil and you can't finish your own thought. Is often forgetful in daily activities, chores, errands, paying bills, keeping appointments, that sort of thing. So this is the inattentive portion. Now, let's move on to the hyperactivity and impulsivity. So 6 or more of the following symptoms. For adolescents, at least 5 are required. Often fidgets or taps with hands, feet, squirms in seat. Often leaves the seat in situations when remaining seated is expected. So this could be classroom, workplace, getting up and down during a movie. Runs about, climbs in situations when it is inappropriate. For adults or adolescents, this is limited to just being restless. Often unable to play or engage in leisurely activities. You try to sit down, but you get up immediately after. It's difficult to just sit down. is often on the go, acting as if driven by a motor. This can be uncomfortable sitting still for long periods of time, restaurants, meetings, often talks excessively, often blurts out an answer before a question has been completed, often has difficulty waiting turn, often interrupts and intrudes on others, butting into conversations, games, activities. So this is the criteria for the hyperactivity part. So you want to get 6, well, in order to have, and you don't want to, but in order to have ADHD, you would have 6 of either of these or both. But that's not it. There's more. But wait, there's more. Several inattentive or hyperactive impulsive symptoms were present prior to the age of 12 years old. Several inattentive or hyperactive impulsive symptoms were present in 2 or more settings: home, school, work, friends, relatives, other activities. There's clear evidence that the symptoms interfere with or reduce the quality of social, academic, or occupational functioning. The symptoms do not occur exclusively during the course of schizophrenia or other psychotic disorders that are not better explained by another mental disorder: mood disorder, anxiety, dissociative personality disorder, substance intoxication, or withdrawal. Now, with the specificity, this is combined: predominantly inattentive type or predominantly hyperactive impulsive presentation. And interesting thing is it can be in partial remission. So someone may have it as a child, but the brain adapts and learns how to kind of function a little bit better. And so the symptoms are not as severe when they're an adult. And so it might not be that there's 6, that they might not meet full criteria. It's something that is biological, doesn't go away, but it can be in partial remission. So this, and then there's also whether it's mild, moderate, or severe. So this is the criteria for ADHD. I hope this has been entertaining, as much as the DSM 5 TR Diagnostic Criteria can be. I hope it's been entertaining, and I hope it's been useful to know what clinicians are looking out for. And if you are a clinician or if you are a student, I hope this has also been helpful. Thank you for your time. Oh, and before you go, could you hit the like or subscribe? That would really help me out. I appreciate it. Thank you. I mean, you don't have to, but I would definitely appreciate it. Yeah, should probably hit the stop.